Hello everyone, I'm Tongxue Zhou, a PhD student at University of Rouen, Normandy. I'm the first author of paper, A Dual Supervision Guided Attentional Network for Multimodal MR Brain Tumor Segmentation. Today, on behalf of all the co-authors, I will present our work. The presentation is divided into 5 parts: introduction, proposed network architecture, implementation details, experiment results, and conclusion. At the beginning, I will give you some backgrounds about brain tumor segmentation. Well, brain tumor is one of the most aggressive cancers in the world. Early diagnosis of brain tumors plays an important role in the clinical assessment and treatment planning. While multimodal images can provide the complementary information to improve the segmentation accuracy. However, brain tumor segmentation is still challenged by the various brain anatomy structure, low image contrast, and fuzzy contour. Here I show you 4 brain MR images with the real annotation from breast 2019 dataset. So in this paper, we propose a dual supervision guided attentional network for multimodal brain tumor segmentation. Following that, I will show you the details of our proposed network architecture. Well, the proposed network architecture consists of 4 parts: encoders, dual attention fusion block, decoders, and the 2 deep supervision paths. Here, the 4 encoders are used to extract the individual features from the 4 different modalities. To obtain the most important features, a dual attention fusion block is introduced. It includes a modality attention module and a spatial attention module. They can reweight the features according to their contribution to the final segmentation, so as we can get the fused feature. And finally, the fused feature is guided by the 2 deep supervision paths to obtain the final segmentation. Here, the first deep supervision path is the reconstruction path, and the second deep supervision path is based on the spatial attention module. We first extract the spatial attention features from the different levels, which are denoted as FSN, FSD, until FSL. And then we use these features to predict the segmentation result. Finally, all these multi-scale segmentation results are combined together to get the final segmentation. Okay, here are the details of our proposed network. Next, I will show you the details of the dual attention fusion block. The dual attention fusion block includes a modality attention module and a spatial attention module. First, a concatenation is used to combine the 4 individual features, and then they are passed to the dual attention fusion block. On the top is the modality attention module. A global average pooling is first used to transform the individual features to 4 hidden nodes, and then a fully connected layer is used to get the modality weights. On the bottom is the spatial attention module. A convolutional layer is used to get the spatial attention weights. Finally, the 2 sides of weights are multiplied with the input feature to get the attentional features. And then the attentional features are added together to get the fused feature. So in this way, the network can weight the feature representations from the 4 modalities according to their contribution to the final segmentation. Well, we evaluate our method on breast 2019 dataset. In this dataset, there were 335 training data. There were 4 modalities: T1, FLAG, T1C, and T2. And there were 3 segmentation classes, including whole tumor, tumor core, and enhancing tumor. We crop and resize image to 128. Bayes field correction is used to correct the distortion of MRI data, and intensity normalization is used to normalize each image. And the loss function is combined by the Dice loss and the mean absolute loss. To evaluate our method, we use 2 metrics: Dice similarity coefficient and Hausdorff distance. Now let's check the experimental results. We first did the ablation experiments to demonstrate the effectiveness of our proposed components, including the dual attention fusion block and the dual supervision strategy. Here, the baseline denotes as our proposed method without the dual attention fusion block and without the dual supervision strategy. From this table, we can observe that the proposed components can gradually improve the segmentation results, which demonstrates the effectiveness of our proposed components. And then we compare our method with the state-of-the-art methods on breast 2019 validation dataset. And we can see that our proposed method has a better result. In addition, we visualize the segmentation results. And here, the first column shows the results from the baseline. And then we gradually added the proposed components, including the dual fusion block, spatial attention-based supervision, and the dual supervision strategy. So the fourth column shows the results of our proposed method, and the last column shows the ground truth. And here, the green box highlights the missegmented regions. So from the visualization results, we can also see that the proposed component can gradually improve the segmentation results. Furthermore, to demonstrate the effectiveness of the dual supervision strategy, we visualize their feature maps. Here, the first row shows the ground truth and the prediction. And the first column shows the 4 different modalities. And the next 5 columns shows the feature maps from the spatial attention-based supervision from different levels. And the right part shows the reconstruction results. So from the left part, we can observe that thanks to the spatial attention module, the network can learn the tumor-related features to improve the segmentation result. And on the right part, we can observe that our method has a good reconstruction result. So we conclude that the proposed dual supervision strategy can enable the network to learn the discriminative features to improve the final segmentation result. So in brief, we propose a dual supervision guided attentional network to do the multimodal brain tumor segmentation. The proposed dual attention fusion block can emphasize the most discriminative features from different modalities, and the dual supervision strategy can help the network focus on the regions of interest. And the experiment results evaluated on breast 2019 proved the effectiveness of our method. And here are the related references. Okay, that's all about our paper. So thanks for your attention, and please feel free to ask questions. Thank you.
Thank you, Tongxue, for the interesting work. Let's see if we have questions from the audience. Please don't hesitate to post your questions in the chat. I have a small question about the deep supervision of the spatial attention part.
Yes.
How do you perform the supervision? If you can talk more about this part. How's the supervision compared to what exactly?
Yes. So the dual supervision path, there are 2. The first one is the reconstruction path here, and the second one is based on the spatial attention fusion block. So from the spatial attention fusion block, we can extract the spatial attention feature. Here is the FS and FS2 until FSL. And then we use these features to predict the segmentation results in each level. So finally, we can get multi-skew segmentation results. And then we add it together and then to pass to activation block, and then finally get the final segmentation result.
Okay, that's very clear now. So it's in fact compared to the segmentation, not to the reconstruction, not to the whole block of the input. Thank you so much. It's very interesting work.
Okay, thank you.
So if there is no more questions, we're see if we have questions.